Viral hemorrhagic fevers, or VHFs. The name itself sounds alarming, conjuring images of a terrifying and deadly illness that can strike without warning. This is not far from the truth. VHFs are a group of serious viral diseases that affect multiple organ systems in the body, causing severe and often life-threatening symptoms. They can cause uncontrolled bleeding, both internally and externally, leading to significant health complications. These viruses pose a significant threat to global health, with outbreaks causing widespread fear and disruption. This essay will explore 5 of the most well-known VHFs: Ebola, Marburg, dengue, Lassa, and Crimean Congo hemorrhagic fever, each with its own unique characteristics and challenges. These diseases, though caused by different viruses, share some common characteristics, such as their ability to cause severe illness and their potential to spread rapidly. They often begin with flu-like symptoms, such as fever, fatigue, and muscle aches, leading to more serious complications like internal and external bleeding as the disease progresses. Understanding these viruses, their modes of transmission, and the diseases they cause is crucial for developing effective treatments and preventive measures. Public awareness and proactive healthcare measures are our best defense against these global health threats, helping to prevent outbreaks and save lives. Join me as we delve into the world of viral hemorrhagic fevers, exploring their dangers, understanding their impact, and learning how to protect ourselves and our communities. Viral hemorrhagic fevers are a diverse group of diseases with varying degrees of severity. However, they often present with a common set of initial symptoms, making early detection challenging. The early stages of VHFs often mimic the flu or other common illnesses. Patients may experience fever, headache, muscle aches, fatigue, and weakness. As the disease progresses, more severe symptoms emerge. These can include bleeding from the gums, nose, or eyes, as well as internal bleeding. Organ dysfunction is another serious complication. Liver and kidney failure can occur, leading to multi-organ failure and death in severe cases. The incubation period, or the time between exposure to the virus and the onset of symptoms, varies depending on the specific VHF. It is crucial to seek immediate medical attention if you suspect exposure to a VHF and experience any of these symptoms. Early diagnosis and treatment can significantly improve the chances of survival. Understanding how viral hemorrhagic fevers, or VHFs, spread is crucial for effective prevention and control. These diseases can cause severe illness and even death, making it essential to know their transmission pathways. These viruses have different modes of transmission, often involving animal or insect vectors. This means that the viruses can be carried and spread by animals or insects, which then infect humans. Ebola and Marburg, for example, are zoonotic diseases, meaning they originate in animals and can be transmitted to humans. This zoonotic nature makes it challenging to control outbreaks. Bats are considered the natural reservoir for both viruses. They harbor the virus without getting sick, acting as a source of infection for other animals and humans. Transmission to humans typically occurs through direct contact with infected animals or their bodily fluids, such as blood, saliva, or urine. This can happen during hunting, butchering, or handling of wildlife. Dengue, on the other hand, is primarily spread through the bite of infected Aedes mosquitoes. These mosquitoes thrive in tropical and subtropical regions, making dengue a significant public health concern in these areas. Lassa fever is primarily transmitted through contact with infected rodents or their droppings. These rodents often live in and around human homes, increasing the risk of transmission. Crimean Congo hemorrhagic fever is spread by ticks, primarily of the Hyaloma genus. These ticks can attach to both animals and humans, facilitating the spread of the virus. The virus can also be transmitted through contact with infected animal blood or tissues. This is a risk for people who work with animals, such as farmers, butchers, and veterinarians. Once a human is infected, these viruses can spread from person to person through contact with bodily fluids. This includes during caregiving, medical procedures, or even traditional burial practices. This includes blood, vomit, saliva, and other secretions. Contaminated materials such as bedding and medical equipment can also be sources of infection. Proper hygiene, personal protective equipment, and safe burial practices are crucial for preventing the spread of VHFs. These measures help protect healthcare workers and the community at large from these deadly viruses. Diagnosing viral hemorrhagic fevers can be challenging, particularly in the early stages when symptoms resemble other common illnesses. Laboratory testing is essential for confirming a VHF diagnosis. Several methods are used to detect the presence of the virus or antibodies produced by the body in response to infection. One common technique is enzyme-linked immunosorbent assay, or ELISA. This test detects specific antibodies in the patient's blood. Another method is polymerase chain reaction, or PCR, which amplifies viral genetic material for detection. However, access to these diagnostic tests can be limited in resource-poor settings where VHF outbreaks often occur. Clinical diagnosis based on symptoms, travel history, and potential exposure to the virus is crucial in such cases. Early diagnosis is essential for initiating appropriate treatment and implementing public health measures to prevent further spread. Healthcare workers in affected areas need to be trained in recognizing VHF symptoms and following proper infection control protocols. Section 5. A race against time, treatment, and management. Treating viral hemorrhagic fevers is primarily supportive, as there are no specific antiviral therapies for most of these viruses. Patients often require hospitalization for close monitoring and management of symptoms. Intravenous fluids and electrolytes are crucial for maintaining hydration and electrolyte balance. Medications may be given to control fever, pain, and other symptoms. In severe cases, patients may require mechanical ventilation or dialysis to support failing organs. Experimental treatments, such as antiviral drugs and monoclonal antibodies, have shown promise in some cases. However, these treatments are not widely available and require further research. Early supportive care remains the cornerstone of VHF management. Preventing complications such as secondary infections and organ failure is crucial for improving patient outcomes. Research into new and effective treatments for VHFs is ongoing, offering hope for the future. Section 6. Ebola, a deadly foe. Ebola virus disease, or EVD, is one of the deadliest known viral hemorrhagic fevers, with case fatality rates ranging from 25% to 90%. This variability in fatality rates depends on the strain of the virus and the quality of medical care available. The virus was first identified in 1976 in simultaneous outbreaks in Sudan and the Democratic Republic of Congo. These initial outbreaks were a wake-up call to the global health community about the potential for viral hemorrhagic fevers to cause widespread devastation. The largest EVD outbreak to date occurred in West Africa from 2014 to 2016, infecting over 28,000 people and claiming over 11,000 lives. This outbreak overwhelmed local healthcare systems and required an unprecedented international response to bring it under control. Ebola virus spreads through direct contact with infected bodily fluids, such as blood, vomit, and feces. This makes it highly contagious in healthcare settings and among family members caring for the sick. Early symptoms include fever, headache, muscle aches, and fatigue, often progressing to vomiting, diarrhea, and unexplained bleeding. These symptoms can appear anywhere from 2 to 21 days after exposure to the virus. There is no specific treatment for EVD, but supportive care, including maintaining hydration and managing symptoms, can improve survival rates. This care often involves intravenous fluids, pain relief, and treatment for any secondary infections. 2 experimental vaccines have shown promise in preventing EVD and are now being used in outbreak response efforts. These vaccines have been deployed in ring vaccination strategies to contain outbreaks by immunizing those at highest risk. The 2014 to 2016 West Africa outbreak highlighted the devastating impact of EVD and the importance of global health security in containing outbreaks. It underscored the need for rapid response teams, better diagnostic tools, and stronger healthcare infrastructure to prevent future epidemics. Section 7. Marburg, a close cousin with deadly potential. Marburg virus disease, or MVD, is a rare but severe viral hemorrhagic fever closely related to Ebola virus disease. The virus was first identified in 1967 in Marburg, Germany, among laboratory workers exposed to infected African green monkeys imported from Uganda. Like Ebola, Marburg virus spreads through direct contact with infected bodily fluids. Symptoms are similar to EVD, including fever, headache, muscle aches, and bleeding. The case fatality rate for MVD can be as high as 88%. There is no specific treatment for MVD, and supportive care remains the mainstay of treatment. Experimental treatments such as antiviral drugs and monoclonal antibodies are being investigated. The recent outbreak of MVD in Equatorial Guinea underscores the importance of early detection, rapid response and international collaboration to contain these deadly outbreaks. Section 8. Dengue, the breakbone fever. Dengue fever is a mosquito-borne viral hemorrhagic fever that affects millions of people worldwide each year. The virus is primarily found in tropical and subtropical regions, with a high burden of disease in Southeast Asia, the Western Pacific, and the Americas. Dengue virus is transmitted through the bite of infected Aedes mosquitoes, primarily Aedes aegypti. Symptoms typically appear 4 to 10 days after infection and can range from mild to severe. Dengue fever is characterized by high fever, headache, muscle and joint pain, and a characteristic skin rash. Severe dengue, also known as dengue hemorrhagic fever, can lead to bleeding, organ impairment, and death. There is no specific antiviral treatment for dengue fever. Supportive care, including rest, fluids, and pain relievers, is crucial for recovery. A dengue vaccine is available but has limited efficacy and is only recommended for individuals with previous dengue infection.